My name is Zach Nahmias, and I am from Germantown, Tennessee. I chose dermatology because it's a visual specialty. Patients have a very good conception of what's going on with their skin because they can see it, unlike things that are internal. And I like being able to discuss with them in that way that their problems that are related to dermatology. Patients also have a better conception of when things are getting better or not when we're going through a treatment approach. That's probably the main reason I went into dermatology. I did my undergraduate work at the University of Memphis, graduated there in 2010, and then went to the University of Tennessee College of Medicine, which is actually based out of Memphis, go Vols, and graduated in 2014 from there. Went up to Boston to do my intern year at Beth Israel Deaconess there in Massachusetts, and then came back to St. Louis to do dermatology residency at WashU. So I took my first job in upstate New York, and it's quite a bit different than the South where I'm from. Decided that I wanted to come back home and serve the community, the area that I'm from Germantown, Tennessee, which is right outside Memphis. My mom and her whole family is actually from Jonesboro. She graduated from Jonesboro High School in 1969. And so wanted to come back to the area, be in a more familiar setting, and be able to help the people in the community. So my mom's family is from Jonesboro, Weiner, Arkansas area. A lot of work in Riceland Farms, and she graduated from high school in 1969, grew up, raised me in Memphis, the Memphis area in the suburbs of Memphis. She's actually a school psychologist there. Dad's family is actually from Indiana. They actually have retired since and moved to Colorado, but a lot of my family still lives in the Memphis area. Big on travel, so travel's really big for me. I just got done with a 3,700-mile road trip from Denver to Seattle, really seeing all the national parks in the U.S. and in the Pacific Northwest. I got to 50 out of 50 states, so that was exciting. I'm big into music, like the Eagles, Jackson Browne, a lot of stuff from like the 70s. Those would probably be two of my big hobbies, into sports and into airplanes and mechanics, that kind of stuff as well. I've always said that I like to treat patients like family members, basically what I would want for myself or my family. I approach every patient that way, regardless of their background, where they're coming from, what have you. So I want the patient to always walk away feeling like I've treated them like I would a family member and given them the best care that I possibly could.